Shall I start? Okay, welcome, sir. Good afternoon. So, welcome to India's seventh summit. Okay, well, I would like to ask you a question. What are you looking forward more in today's event?
Shall I tell? I'm sorry about it. And shall I introduce myself and tell, or that's not necessary?
If you want to introduce, you can.
Yeah, yeah, that's. I'm a. Um, my name is Dr.K.S.Murthy. I'm the chief pediatric cardiac surgeon from Innova Children's Heart Hospital, and they have invited me to give a keynote address on challenges in establishing pediatric cardiac services in India and the road ahead. And this Pharmaleaders event is that not only they cover the pharmaceutical aspects and also the end user, the patient, and how the health scenario in the country as a whole. And since I am a children's heart surgeon, it's a neglected specialty, and not many centers in India they have. Even they have, they're struggling to come up and to serve these unfortunate children suffering from heart disease. And I have spoke today on 7th Summit on my personal experience to how to establish the dedicated children's heart hospital, and what are the hurdles we get. And look at the children's heart disease, it is 8 per thousand live births. That means, more than 1 billion population every year, almost 2 lakh children are born with congenital heart disease, but unfortunately less than 10% are getting the treatment, and rest of the people are dying or suffering with congenital heart disease. The reason being that the most of them belong to lower socioeconomic background and require huge infrastructure to serve or operate on a tiny tots hearts. And so the not only the doctors, the non-governmental organizations, philanthropic organizations, and also the government should and the angel investors should support this set of cause. If you look at the Indian scenario, it's a very minuscule service we are doing. As per the American College of Cardiology recommendations, we should have one pediatric cardiac center in every 5 million population. And if you have 1 billion population, at least 200 centers we should have in India. But we have hardly 10 centers doing this sort of service. Maybe South India a bit more, and if you go to North, except Delhi, nothing in between. Mostly the central part of India and eastern part of India, we need this sort of services. So there is a huge potential. And so someone has to take this challenge and spread this message and establish more centers and serve these poor children and unfortunate children. Thereby, they can also see the light of the day, and also they could be useful citizens.
Thank you, sir. So, I would want to know, will Make in India be just a slogan, or there is something more to it?
Okay, the Make in India, if you look at the manufacturing sector, people think manufacturing sector is not only the Make in India, and the service sector also should make in India. And we have reached very good forward step in that, but it's a long more to achieve in this, and it's a good slogan, but it got up very late, and also it is to say whether it is going to happen or not is very early to answer this. But everyone, and including Prime Minister and the people and entrepreneurs, are all moving forward into the Make in India. But no doubt, but I see that the younger talent what we have at this moment in India, definitely I hope that we'll have a better future and make India. Thank you.
So I would want to know, if you see, there is a huge disparity between urban and rural healthcare sector.
Yes.
Now, as you said that, we don't have much pediatric sector. We have everything. We have good doctors, nurses. Then why are we laying back? What is it that we are laying back and everything goes to US and not to India? I mean, why are we laying back?
But don't take me wrong, but my personal experience and opinion is that the India is progressing because of people's efforts. The government is actually playing as a positive role, like catalytic role, but actually they are playing a very negative role. And whatever want to do, have lots of red tapeism, lots of things, and which is, and there is no clarity what they want actually. And also the health sector is one of the most neglected sector in the country, and the budget what we have is very minuscule, is less than the budget spent by Bangladesh or Sri Lanka. And when you compare with the Western world, actually you are nowhere into that. And I think we should, at this moment, we should concentrate more into the rural sector and preventive diseases, and where communicable diseases. Most of the children and most of the people suffer from these communicable diseases, and and what you have to understand is what is the real cause for Indian health scenario in this country, and you have to address that concern rather than giving populistic schemes, starting populistic schemes, and giving populistic the lectures. Not that, we should show in action the cause and how to solve this problem.
Thank you, sir. Sir, you think telemedicines and M-health, it is going to help, to bridge the disparity between rural and urban sector?
No, the telemedicine and health definitely will help. Definitely will help.
As you see that like one third of the people in rural sector, they don't get hospital. They are only they are allowed to get hospital beds. Rest of the people, before getting treatment, they die. So do you think technology can help to bridge the gap between the rural and the urban sector?
Yes, see, technology definitely make things easy and accessible to the remote areas. That is definitely, and that will help. But the thing is, what you should not forget is that educating the public, educating the health hygiene, and educating the disease. I sometimes I feel really upset when I see in the TV getting advertisements on soap, shampoo, and other things, but no advertisement comes on the health sector. Why can't we do that? How to by washing the hands, you can prevent diarrhea in children or infectious diseases in children. When you sneeze, put your towel in front of you and don't spread your bacteria and virus to other people. Okay, so that is what that's what I think. Not only the government, the philanthropic organizations, and also the industrialists, they can sponsor this sort of programs, and also they can put their product into that. But main thing is like health education. Yeah.
Thank you so much, sir. Thank you.
So, good afternoon and welcome to the 7th annual Pharmaleaders Summit. Can you give me a permission to ask you 2-3 questions? My first question is, how, according to you, is the Modi Care campaign successful in the pharma industry today?
I'm not sure about it. I don't know too much about it, but I've been watching the pharma industry for over 45 years, and I have great faith in its growth. It's already been very successful, in spite of many people saying that there are all sorts of restrictions and hindrances to growth. But I see it as an amazing industry that produces the cheapest products in the world of very high quality at very low prices, and also still makes a profit with which it grows. So I don't think there's any problem in the industry.
Okay, so how can you forecast the Indian pharma industry today?
It's going upwards, skywards. It'll keep growing. It's one of the fastest growing industries in India, and certainly growing much faster than most countries in the world.
You being at a senior position, can you give me some insights, like what are the opportunities in pharma industry for youngsters like us today?
Well, I think there's a lot of opportunity in all areas. The pharma industry tends to be very inward looking. It generally hires people from other pharma companies, whereas they should hire people from other industries. So young people coming in with a slightly different background, like you've done an MBA, will bring a lot of fresh approach in the pharma industry, and I think you have a great future.
Thank you.
Okay, good.
Thank you, sir. Thanks a lot.
Good questions.
Good afternoon, sir. If you give me permission, I will ask you a few of number of questions. Yeah, so according to how successful will the Make in India campaign for the pharmaceutical sector?
It'll be very successful. It'll be very successful, I'm very sure.
Okay. Can you tell us about two things you've done in last 2 years?
You mean what, me?
Yeah, I mean good things. Yeah.
Or IDMA?
Yeah, IDMA, your company done from last year.
I don't represent a company. I'm the Secretary General of the Indian Drug Manufacturers Association. You want me to repeat again? Yeah, I don't have a company. I am the Secretary General of the Indian Drug Manufacturers Association. And we do a lot of things to train our members so that they get into the quality approvals and quality improvements that take place in the global world of pharmaceuticals. So we organize a lot of training programs, a lot of workshops and seminars. We do a lot of harmonization with various pharmacopoeias. So this year we had a very good event called the Pharmaceutical Analyst Convention, which saw people from various companies, from various departments, quality control, regulatory, manufacturing, R&D. And we had Dr. Ronald Pierre Vincenzi, the chairman of the USP from Washington, who was the keynote speaker. We take up issues for companies if they have problems with pricing, if they have problem with some exempt policy, or if they have some regulatory issues. We take up matters and try and resolve these problems.
So what according to you can be done our government to make healthcare accessible in a rural sector?
Well, main thing is infrastructure and storage facilities and distribution facilities of medicines in the rural areas. Today our companies are willing to supply at cost or even at below cost as a CSR initiative, if not anything else, to the government to give medicines to the poor. But unfortunately there are no dispensaries there. There are no proper roads where the goods can be taken carefully. The goods can be stored in the right temperatures. So that is the problem. If the government takes care of these things, medicines will be accessible by the poorest of the poor in the rural areas.
Okay, sir. Thank you, sir.
You're welcome. What's your name?
Monica, sir.
Monica what?
Monica.
I'm Dr. K.S.Murthy, attached to Mumbai Police, a sexual... Should I start again? Okay. I'm Dr. K.S.Murthy, attached to Mumbai Police as a sexual health physician and a counselor. I'm also attached to Raheja and Hinduja Hospital. I'm an American board certified clinical sexologist.
Good afternoon, sir. My first question to you would be, at what age should children be exposed or acknowledged to sexual education in India?
There is no particular age as such, but as soon as your kids start asking questions related to their private parts or anything related to sexuality, you should be open and you should be frank and you should be transparent and give them an honest, frank answer to their queries. There is no particular age, but yes, every education in sexuality should be given to them at least or not later than 11 or 12 years of age.
But our Indian culture, our parents, they don't think likewise. They restrict talking about such topics. They are more inclined towards the culture, the emotions, the society, what they portray, but nothing about the sexual education. When I was in the school, at 8th standard, we were exposed to sexual education, but the other friends, they were not exposed. Only our school had sexual education program. So what do you think? India must look forward for the sexual education programs or no?
Yes, the reason why we have too many rapes, too many gang rapes, sexual assaults, harassments, sexual dysfunctions, increased unintended pregnancies, sexual transmitted infections, HIVs, all this is because of lack of sex education, misconceptions, myths and misinformations. So sex education is a must, and it should start as early as in the 7th or 8th standard of the schools.
I would like to talk about the Farhan Akhtar campaign, the Mard campaign, Men Against Rape and Discrimination. Would you like to comment on it? Would such campaigns be more encouraged in India?
Yes, such campaigns should be encouraged, but these are NGOs which have started, as an extra thing. But the government should take up the onus on itself, as to it's the moral duty of the government towards our kids, our school going kids. They should impart this education, what Mard and all other organizations are doing it. But yes, they are doing a commendable job. But I feel we as parents should teach our children, our boys, to become more responsible and respect feminism and adore feminism.
Okay. Thank you for this interview, sir. The slides were very fascinating, and the word, the sex word, you took it for, matlab, the word was repeated over for a longer time. If I say it to my parents, like, I can't even say sex in the house. So I am like very thankful to you. I mean, I can talk to my brother, my younger brother, at least on this topic.
Talk about it, yeah. Why we should not? We should definitely talk about sex. And when there is a query in your mind, whom will you ask? You have to ask your parents first, and your parents should answer you everything about it. See, my father taught me how to sit on the shit pot and pass shit, how to tie shoelaces, how to use knife and fork on the dining table, but he never taught me how to have sex. How am I going to learn? Why I should not be taught about it? And we call that sex is our body's normal and natural function, like we urinate, we pass stools, we breathe, we eat food, our heart beats. Sex also is our normal and natural body function. But every other function has a regular frequency, like we pass urine 4 to 5 times a day, we go to stools for 2 to 3 times, we eat 3-4 times a day, our heart beats 60 times in a minute, our lungs expand and relax for 20 times a minute. But do we have regular sexual frequencies? No. And that's the reason why dysfunctions and all these things occurs. And in our practice also, we find patients don't talk about it. And I've seen generally doctors also don't ask about the sexual histories. And if all the doctors start asking one simple question, they ask about allergies, they ask about surgeries, they ask about all sort of addictions, smoking, alcohol, etc. But they never ask, do you have any problems in making love? To any couple who comes, if they start asking these questions, there will be more awareness, there will be more opportunities for the doctors to treat them and give them the right information.
Sir, I wanted to ask you, what kind of people come to your clinic? I mean, what age group of people come to your clinic? Because on basis of that, I would like to know, is it the younger generation or is it the older generation that come to your clinic and seek sexual education? Or
see, I get patients who are above 18 or 19 to geriatric age, male and female both. I even get gays, homosexuals, I get lesbians, I get transgenders, I get all sort of patients. And for us, patients come and tell us their complaints openly, but they would not tell all these things to their family doctor, because they have a fear that their family doctor might tell the other members of the family, one, or they also have a fear that my family doctor will make a judgment about me or form an opinion about me. And that is why they run to other doctors who do not know them. And that is why quacks have really flourished in our in our country, especially in this field. We find a lot of unqualified practitioners doing wrong things and giving wrong advices, promoting more misinformation and myths to our generations.
I have seen many bloggers of my age blogging about sexual education, about the Indian culture, about sex and Indian parents. How do they react to all these chaotic things? But will this stop? Will the blogging, will the Facebook, Twitter stop commenting upon all these things? Will the rape stop eventually in India? Should there be potent I'm sorry, I'm fumbling. These, for such crimes, should there be something implementing?
Yeah, it's true. Your concern is very true. See, a small toddler If he sees a snake going by, he'll go and hold it. Okay? Because he doesn't know that the snake bite will kill him. But you will not hold a snake because you are aware, you are educated that that snake is poisonous, and if you go near it, you might get bitten and you might die. Similarly, if every part of sexuality is made to understand to kids before they become pubertal or before the menarche sets in a girl, they will be more aware of what they have to do. They have a choice then. They can choose. Today, if you are made to aware that you have to be pressure proof, you have to avoid being abused, it is your right. You can easily fight for yourself. You can protect yourself. If I teach you self-defense, if I teach you how to avoid getting into situations or opportunities where you can easily be taken for a ride, then you will become more smart and you will avoid getting it. And if this is practiced everywhere, if this is proposed everywhere, definitely the rates of the crime rates, everything, rapes, gang rapes, everything will come down. Definitely.